Okay guys, so finally this video has been put off way too long. I'm supposed to talk about my journey after. So this is part 2 of my weight loss journey, and I have recovered fully, mashallah, from my procedure. Let's do it. Okay, so what happened was that I had been working out with Reconstruct official for a long time. I think it had been a month or 2 months, I think less than 2 months, but I had been going to them, following the routine, trying to follow the diet plan that they had given me, and the results were amazing. So I was feeling super tight, I was feeling stronger, healthier, mental, all those benefits from working out were coming. But at the same time, my body was finally forming to be the shape that I wanted it to be or wanted to achieve. However, there was still a pouch in the center of my stomach and then my arms. So if I put it out right now, this is my arm size. Before, if I was to wear something fitted like this, my arms would literally be from just this little portion, it would be this much, and then go down to being thinner. So it was odd, it wasn't the correct proportion, but this is my arm now after my surgery. So there were these two body areas that were really bothering me, and no matter how much I worked out or the meal plan that I followed, that looseness just wasn't getting tight, it just wasn't fixing. So I decided to get a consultation from a plastic surgeon just for him to assess the skin and be like, I tell him that I've been working out, I've been following everything, but this area is not going away, and I have a feeling that it's just extra skin. During the last year, I had like been online trying to understand other people's journeys who had like lost weight quite rapidly, and this was a case of losing fat, losing weight like rapidly. It just lose, and then the unhealthy way. So by with not working out, so it leaves a lot of loose skin. If you're on a healthy diet and you have a healthy workout routine, as you're dropping the weight, you are also melting the fat away and tightening the skin. I just did one extreme and an extreme diet, so I dropped too much weight. I'm gonna try to keep this video short because all my other ones go on like to like 20 minutes. So went to the first doctor, then I went to a second doctor, and then I went to a third one. I'm not going to name them because they all basically directed me, and I went up to them doing my research and saying, oh, I need a tummy tuck for this one, and then I need an arm reduction. All of them agreed, her and her husband, who recommended Moazzam Tarar to me. I can never say his last name, and I hope he's not watching this if it's a wrong spelling, but they told me about him, and I had already heard about him quite a bit. He checked my areas and assessed the skin, and he said yes, this is quite loose skin. However, he told me that I do not need a tummy tuck, and I'm not a candidate for a tummy tuck, and I was quite like shocked because I went in with my notepad and I had all my questions ready for like post and pre and the procedure itself. And he's like, arms, yes, it's a simple reduction, but for your stomach, a tummy tuck at your age, unmarried, it's quite invasive. It has a lot of post-surgical complications that someone your age shouldn't have to go through. So he recommended, and I cannot pronounce this, a Mini-Abdominoplasty, I don't know, whatever it is. He recommended that, and then I was like quite shocked. So I said to him, okay, can you explain the procedure, because I had only done research. And then he told me what videos I could watch, and he told me about the procedure. So main difference between tummy tuck and what I got: a tummy tuck is way more invasive. The cut is above the belly button in a semicircle, and then they actually drag that skin all the way down to your hip line, and they actually give you an artificial belly button. So they have to cut around your belly button, pull that skin down, stitch the belly button. You have tubes in your abdomen because all the excess fluid has to be drained. The recovery time for a tummy tuck is 3 months. And what else is there? Yeah, and then you also have a hunched back because they've pulled the skin so tightly that it takes time for you to actually be able to like sit straight again. That is tummy tuck, and that is not what I got done. My experience was with the mini abdominoplasty or whatever, and I was told that the recovery time for that was a week to 2 weeks. However, it actually ended up taking a month because I got it done in this weather, like a month before. And in this weather, things heal slower. However, mashallah, the recovery was great. Like, I don't have an issue with my scars, anything of the sort. Going into this, yes, I knew there would be scarring. The doctor told me 1,000 times. I had thought about it 1,000 times, but I'm totally okay with scarring. So everyone did warn me about the scars. I was aware of them and I had given it a lot of thought before getting it done. So totally okay with that. I do currently have scars. Not a problem. Mm, Moving forward, so that's what a tummy tuck is. What I actually ended up getting was the mini abdominoplasty. I'm just gonna call it the mini A. Okay, I got the mini A procedure, and this cut is actually done below the belly button in a semicircle form, and then they pull the skin or drag the skin from there on to your hip or wherever the cut is made, wherever the incision is. So that's the procedure I got done, and my arms at the same time. This was at Amar Hospital. Amar Hospital, might I just say, is the cutest little hospital ever. It's vintage. My gown that I wore post pre-surgery was like little. It had little flowers on it. It was purple. The room that I was in was like orange and retro and super cute. The bathroom was not like the nicest, but it's okay. We were just there for a night, and the room was quite spacious. Like all my family was there, my friends were there. Love you guys all for being there, but yeah, it was a cute room. Quite. I was at this point, I still hadn't absorbed it. I was just really excited that it's my procedure day finally, all that stuff. Then I went into the room, checked in, changed my gown. They came and they gave me some oxygen, or they gave me something to clear it's like nebulizing, I think. Not oxygen, they gave me a nebulizer. And is that oxygen? I don't know, but they gave me a nebulizer to clear the system because I was going to go under anesthesia. And after that, when time came, they took me upstairs to the pre-op. In pre-op, I had requested for them to put me out in pre-op. I didn't want to go inside the operating theater and be put out there because I feel like it would freak me out. So when I was in my room and when they were taking me to pre-op, they put me in a wheelchair and we went to the elevators, and all my friends were like, family were behind me. So as they like turned me around and reversed me into the elevator, and I just saw all my friends standing there and my family, and I'm just in the elevator, like literally like 5-10 people standing in front of you. I was like, it like started, my heart started racing, and I started to like kick in, like, okay, I'm going into the procedure now, like I'm gonna be alone and they're gonna put me out, and what is anesthesia gonna feel like when I wake up? All these questions started like popping into my head like rapidly, and I really did have a mini panic attack, but like a happy panic attack. I don't even know how to say it. Like so nervous but so excited at the same time, not in a bad place. But yeah, oh my god, that was an exciting time. Went upstairs. The anesthesiologist was the sweetest guy ever, like totally obsessed. He came in and he was like cracking some jokes and patni kya kya kya, and then I was laughing. Then he put the drip in me, and I got one drip of some fluid, I don't know, and then usi canala se they put me out. And I remember one friend of mine, ZM Events, was in the room at that time when they were putting me out. I remember just lying down, and literally I think a minute after he put the liquid in me or the medicine in me, and I remember seeing her and I started feeling like, oh, like heavy, like my eyelids were heavy, and I just went, like I just knocked out. Literally it feels like 5 minutes have gone by, or 5-6 minutes have gone by, and I wake up, and it had actually been 3 hours, 3 or 4 hours. I woke up and I was on the gurney, and they were taking me out of the operating theater, and I was on my way somewhere, so I don't know where it was. And both my arms, because they had done my arms and my stomach, both my hands they had placed on my stomach at the lower end of it, and my arms were like squeezed like this. I was in a little gurney, they were taking me, and I remember like seeing 4 guys here, a couple of people here, like just taking me in the gurney. And so at first I noticed that, and suddenly I noticed that my hands were like this on my stomach and it was flat. So this entire time, no matter how much I worked out, no matter how much my collarbones popped or my other areas felt tight and skinny, I would always, when I was sleeping or whenever I would touch myself like on my stomach area, there would always be a lamp. There would always be a lump, and there'd be a chunk or something that would come in the way. this is for the first time I wake up and they've positioned my hands there, and it felt like, sorry I'm stressing on this so much, but I don't know, that feeling I will always remember. And automatically when I felt that, and I was like just absorbing that feeling, and then oh my god, it's flat, and there was no pain. Like I had a lot of drugs in me. I just started crying. So at this point, they stopped the gurney and they're like, "What's wrong? What's wrong? Are you in pain?" And I just couldn't stop crying. Like I kept like, and the oxygen mask was on me, so they couldn't tell, but I was like smiling and crying, and I was like, oh, whatever. I don't even know what face I was making, and I just couldn't even catch my breath from crying to actually be like, no, I'm okay. But they stopped the gurney. Everyone's like, oh my god, blah, ye check karo. I don't know what they were saying. They panicked. Literally, I took a breath and I said, nahi, nahi, main khush hoon. Like, I remember just saying, nahi, nahi, main khush hoon or something. And those guys started laughing, and then they continued taking me to my room. I think I passed out then because I don't remember getting into my room. But then when they were transferring me from the gurney to my bed, then I remember waking up and everyone was there and saying congrats. I don't know what they were saying. I passed out. That entire day, so doctor had told me that you will be able to go home after the surgery because it's not that extreme. But I had decided to stay the night, and I'm so glad that I did, because the service at MR Hospital I received, I had a very good experience. Nurses were on point, super kind. Every time we called them in, good with it, because sometimes I'd feel like the drip is coming in too fast. But that entire one night until like 10-11 a.m., I think I was out of surgery by 5, 6. Until the next day, I was in and out of sleep. So there were some friends who came and visited, and I would wake up and have a conversation with someone, and then just while talking, like pass out again, or to change the drip or to get a new one. And so the pain management was fantastic. Like I did not feel pain of the sort. It was uncomfortable, but nothing was painful. Then I had to go to the toilet. So that was a bit scary. Because I got my arms and stomach done at the same time, I couldn't even like put pressure and get up like this if I needed assistance. And they had my friend like Remit, by the way, shout out. I'm gonna do a whole section. I should do a whole another video on Remit. Okay, there was a little bit of pain, but not unmanageable. And the pain was of pulling and stretching. Like this area was super sore. There was a lot of soreness. My arms, they had wrapped with gauze, so there was a lot of pressure, so that didn't hurt at all, like moving around, but my stomach area did. And then there was also at one point during that day like some bleeding that was happening, which is expected, because he also ended up actually, doing a little bit of like lipo, he told me, on my arms and a little bit on my stomach areas to aesthetically make it look good. So what I love about Moazzam Tarar, I would recommend him 1000 times over, is that he's a perfectionist, and he did not need my consent for that. I'm so happy that he did it, because now that my arms have recovered, they aesthetically look proportionate to my body. So I'm super proud of that, and you know how important aesthetic is. So yeah, there used to be a little bit of bleeding, but they changed the wrapping and that was completely fine. Ramit stayed at my house with me as my private nurse, the best of the best, for the next week, I think, week 10 days. She had moved in and made a little chart with Eamon about what dosage, when I'm supposed to have it, all of that stuff. Everything was super organized. For a week, I think I got this one on Wednesday. After a week, I went in to get my bandages changed and my staples removed. It was a super easy process. I think the Dr. Moazzam's assistant took them out. Clean process. Obviously, it was like I couldn't look at it when she was doing it, but it wasn't painful at all. And after that, I just had to keep another surgical tape on both the cuts until it healed. One thing that I really wanted to put out there, and I actually was excited to talk about, is the post care of surgery, or at least my surgery. In my head, even though I had prepared, researched, talked to the doctor about it, I didn't realize that how important the recovery period is, and how like strenuous to an extent it gets mentally even. I was in bed, on bed rest for almost a month. So obviously like a little bit of moving around, walking here and there. But I remember the first time I showered, I felt super dizzy. I almost fainted because I had been lying down straight in bed for a week. Initially when I got the surgery, the doctor had said when I got home that sleep straight on your back because you don't want to turn side to side. And I obviously couldn't sleep on one arm. So I'm used to sleeping on my stomach. I always sleep on my stomach or on my side. So sleeping straight for 10 days, that was like really painful mentally. It was like a mental torture. I was really happy finally when I was able to turn sides and all that stuff. Other than that, I was feeling gross because I hadn't showered in such a long time. So when I finally, like, they washed my hair once, which was the entire process. It took Remit and two of my staff members to wash my hair. But I was really happy the day I showered. Felt dizzy. Had to have apple juice in the bath tub, um, with my maid standing there. But yeah, this wearing that tape was also, by the way, quite annoying because every time you'd put the tape after showering, removing it, it would just like pull and tug on the wound. So that wasn't the best. It wasn't painful once again. It was just extremely uncomfortable and cringy. So that was a bit like, just didn't realize that I will have to be, because actually the Moazzam was such that I couldn't go outside and I couldn't risk sweating and getting like sweat stuck in the wounds because they hadn't recovered, healed up properly. So for 1 month, even though I could move around by the end of it, I had not left my house. I had not left my room, because I didn't want to sweat, and that took a big toll on me mentally because I'm not used to staying at home this much. That's it. Like, the recovery period was decent. It was at home, not much. Like, I can't complain that much because at least I did get to spend that much time just relaxing and not doing anything. But for me, it's just not ideal. But it's a vacation. I don't want to be like too negative about that. Honestly, out of this whole process, the only annoying thing was the amount of bed rest that I had to do. Other than that, pain management phenomenal. The procedure went by beautifully, mashallah, like sugar alhamdulillah. Honestly, the scarring, when I looked at the scars, my biggest concern about the scarring wasn't that there would be a scar, that it wouldn't be straight. But as I've mentioned before, Dr. Moazzam is an aesthetical genius. Okay, but I'm wrapping up. If you guys have any questions, please feel free to comment underneath this, or if they're a little more private, you can DM me on Keeping Up with Khan. I think I've covered most, probably the entire process. I think the overall like mental state that I haven't spoken about. I feel so much more happier with my body. I've joined Reconstruct again. I'm excited to see the results that I feel like I've worked really hard for. This has been a 5-year process, and I learned from doing that extreme diet. It left me with no option but to get the surgery done if I had lost weight the right way, naturally, by dieting, and doing a healthy workout. I most probably wouldn't have had to go through this procedure. It is a lot of money, and obviously it's a health risk going underneath anesthesia and whatnot, and as a risk with the recovery period you can get infections, anything can happen. So might as well not put yourself in a position where you have to. But I feel like if you are struggling with an experience with excess weight loss and having that saggy skin, definitely look into I don't know, getting a procedure, or getting help for it. The answer might not be surgery. There might be other methods depending on how bad or extreme your condition is. But mentally, I feel so happy with my body. And after a month of me, like after I had even recovered, a month after that, I remember, I don't know what I was doing. I was either trying on something or I had just like worn my night suit and sat down. There was just a moment where it hit me that I think it's been a month that I haven't had any issue with my body. Like, I'm really happy with it and I felt content. And I don't know, when for a decade or a very long period you have one negative thought in your head about yourself, the other things you work on, if you don't like your routine, that's something you can change. I feel this aspect about my body, I felt like was out of my hands because I had done everything and I had tried all other methods to correct this, but nothing worked. So finally having this done and knowing that I can start my journey into a fitter looking body, or like when I work out the results will properly show because I don't have this excess skin hanging on my arms and hanging on my stomach. I don't know, it just really motivated me to get back into the gymming lifestyle. And yeah, I don't know, it was really good. And I thank God. I think I said do nafil to thank him, and I thank him on a daily for giving me the strength, for giving me the ability to get this process done. Yeah, overall, great experience. I will put Dr. Moazzam's number and contact details below in case anyone's looking for them. He opened a skin clinic also recently. I'll put all the details down below, but I hope this was informative. I'm so sorry for the delay for this video. I should have done it sooner, but it is what it is. Enjoy. I hope everyone's having a great time.